So I just finished listening to the podcast with Dr. Mike and Senator Chuck Schumer. And as a physician intimately studying the US healthcare system, I have some thoughts. Now, I really respect Dr. Mike's work. He's doing a great job giving people like Senator Chuck Schumer a platform to dive deep into issues with more depth than usual media sound bites that the public normally gets. But I was left wanting a tougher conversation on a few key points. So Schumer's perspective didn't really get pushed enough in the podcast, especially on the government shutdown and the Affordable Care Act failures. And honestly, if he's serious about fixing healthcare costs, there's a lot of low-hanging fruit that Schumer has ignored for years, and this includes certificate of need laws, site-neutral payments, and Stark laws. So let me break this down for you. First off, Schumer's take on the government shutdowns being a Republican problem felt a little bit one-sided. Look, I get shutdowns are messy and nobody wants them, especially when they mess with healthcare funding for programs like Medicare or Medicaid. But calling it the Republican shutdown ignores how this actually plays out. There's been clean, continuing resolution bills, known as CR bills, on the table, and these bills that don't try to sneak in any new politics just want to keep the government running while negotiations happen later. When those get shot down, it's usually the party voting no that's owning the shutdown. Now, both sides have played this game before, and it's not just one party's fault. To shut down a government to negotiate on subsidies that were set to expire specifically by Democrats and do not even expire yet does, however, feel a little bit disingenuous. Therefore, it's hard to see how the Democrats aren't the ones holding the government hostage in this specific scenario. Then there's the Affordable Care Act. Schumer spent time defending the need to extend COVID-era subsidies, but nobody asked the obvious question. If the ACA passed in 2010 and is doing the work that it's supposed to be, why do we still need these emergency subsidies 15 years later? The whole point of the ACA was to make healthcare affordable, right? But costs have just kept climbing, premiums are through the roof, and deductibles are so high that a lot of people feel like they're paying for insurance they can barely use. Since 2010, some studies show individual plan premiums have jumped 50% or more, and families are getting hit even harder. Those subsidies, which started out as a COVID fix, are now being pitched as a permanent band-aid. And that is just not an overall solution. It's a red flag that the ACA isn't delivering, and a real talk about why costs keep rising under the ACA must be had. So here's the crux of the ACA problem. Yes, it insured more people, but for a lot of them, that insurance is now practically useless. More folks have coverage on paper, but sky-high deductibles, sometimes $5,000 or $10,000 or more, mean they can't afford to actually use the insurance. Families are paying big premiums every month only to find out they've got to shell out thousands before their insurance even kicks in. That's not healthcare access, it's actually a financial trap. So the ACA's focus on getting everyone insured ignored the real issue, affordability. People aren't just struggling to pay for insurance, they're struggling to pay for care, period. And this is why we need a major overhaul, not just more tweaks to prop up the ACA. Band-aid-like subsidies keep the system limping along, but they don't fix the core problem. Patients are getting squeezed while the system stays bloated. We need bold reforms, like letting markets drive competition and giving patients real control, not doubling down on flawed laws. Now, the biggest head-scratcher, though, is how the ACA turned out to be a massive win for insurance companies, the same ones Democrats, like Senator Schumer, usually call out. Since the ACA kicked in, insurers have been raking in profits. The law forced millions of people to buy their plans, guaranteed them customers, and threw in subsidies to sweeten the deal. Meanwhile, patients are stuck with higher premiums, bigger deductibles, and less choices. If insurance companies love the ACA, that should tell you something's off. In our talks before, I've pushed for ideas like expanding health savings accounts, making prices transparent so patients can shop around, and letting direct primary care models grow. These put patients in charge, not insurers or bureaucrats. But Senator Schumer is still leaning on the same old playbook, propping up a system that's clearly not working for regular people. So I'm going to try and give Senator Schumer the benefit of the doubt here. I believe he thinks these policies are helping people, but if he's serious about tackling healthcare costs, there's so many fixes he could have pushed for in all his years in Washington, and he hasn't. Take certificate of need laws, for example. These rules force new clinics, surgery centers, or even hospitals to get a permission slip from the state before they can open or expand. The idea is it's supposed to prevent too many facilities, but what it really does is protect big hospital systems from competition. Smaller players like independent doctors or new outpatient centers get blocked, and that means fewer choices for patients and ultimately higher prices. I've said before that letting the markets work, letting new providers compete, would ultimately drive down costs and spark innovation. So why hasn't Senator Schumer taken a swing at these laws? It's a question that needs asking. Another big one is site-neutral payments. Right now, hospitals get paid way more than independent doctors' offices for the exact same procedure. Say you need an MRI or colonoscopy. Same type of doctor, same equipment, same quality. If it's done at a hospital, Medicare or private insurance might pay hundreds to thousands more than if it's done at a private clinic. Now, that's not just unfair, it jacks up costs for everybody and pushes independent practices to sell out to big hospital systems. The result? Less competition, higher bills, and there's been talk about site-neutral reform for years, paying the same no matter where the service happens, but it's gone nowhere. Schumer could have been a leader here, but it's barely on his radar. That's a missed chance to make healthcare more affordable without some big, complicated overhaul. Then there's Stark laws. These rules stop doctors from referring patients to businesses they have stake in, like an in-house lab or imaging center. Now, it sounds good on paper. Nobody wants shady referrals. But in practice, it kneecaps independent doctors trying to offer cheaper, more convenient care. If I want to set up a lab in my office to save my patients time and money, Stark laws make it a legal nightmare. Meanwhile, big hospital systems find workarounds and they keep getting bigger while independent practices struggle. Reforming Stark laws to give doctors more flexibility while still keeping things ethical could open up the door to better, cheaper care. But it's another fix that Chuck Schumer hasn't really touched, and I'm left wondering why. And also, the Republicans themselves have not proposed a good plan that addresses these same issues. At the end of the day, I'm frustrated because healthcare doesn't have to be this broken. The shutdown fight hurts patients when funding for programs stalls. The ACA is not living up to its hype, and subsidies are just masking the problem. And there's fixes. CON laws, site-neutral payments, Stark law reform, HSA transparency that could make a real difference without reinventing the wheel. Now, Schumer has been in a position to move the needle for years, but we're still stuck. Dr. Mike's podcast was a chance to dig into all this, to really challenge the status quo, and I hope next time we get the kind of conversation, one that puts patients first and calls out barriers holding us back, not just a political game.